So you have the cove. What do you do now? Uh-oh. Hey guys, thank you for coming over and hanging out with me. We're going to talk about today if you have cove or even post-jab cove, a few tips maybe that can help you out with that, okay? The reason I want to do this video is because public health did not tell us anything about if you get cove, like what do you do next or anything, or what you should look out for, or how to just anything. Like all they said was put mask on, get under the bed, don't go outside, don't get it, and then when we give you your magical jab, you'll be fine, and then that's it. And none of which came true. Then when I was working at the Department of Public Health, I would get phone calls. I would do the contact tracing, and I would get people on the phone like, I don't even know how I got this thing. I had my mask on the whole time, and what do I do now? Okay, so let's talk about it. First thing you do is you call your doctor. Let's make it clear. Let me get this out the way right now. I am a nurse. I'm a registered nurse. I definitely have background in assessing and treating patients with respiratory distress and all kinds of other distresses. However, this video is not me treating any patients, okay? This is just a video of tips. You get sick, you call your doctor. You can't breathe, you call 911. We're just talking about tips just so people can have an understanding of what this thing is. Anyway, that was the part Fauci was supposed to do and he didn't do. So let's do it now. So first, let's talk about what cove is, okay? And so cove is, so I put, there's certain words I don't say because algorithms might pick them up. Next thing you know, they take down my video. I put the legend in the description, okay? So cove is the symptoms that present after you've been infected with SARS-CoV-2, which is the virus that enters your body that gives you those symptoms, right? So SARS-CoV-2 is a coronavirus. Coronavirus has been here for a long time and is like one of the many cold viruses, okay? Let me make this clear too. Because they are still saying this is so new, everything is still a theory. I've never heard of anything like that in my life. Like, we're almost 2 years into this. Like, how come I can't find the full pathophysiology for sure of how this virus goes into your body is beyond me. But what I can say is what I was reading, yeah, this was something that was beefed up a little bit more in the lab, you know? So that doesn't mean it's the most deadliest thing out here, but come on, okay? So anyway, SARS-CoV-2, they said there was certain theories about pathophysiology of it, okay? So I'm going to try to break it down as sensible as I can. In your lungs, there's something called angiotensin converting enzymes, okay? That they convert different enzymes. So basically for you to get your good breathing going and everything. So those enzymes, they say that the virus can attach to those enzymes, and then that's how it starts traveling through your lungs as fast as it does. That's one way. Of course, obviously, all right. Obviously, you're getting the virus through your mucosa. A lot of people say it's really mostly the eyes. But, nose, mouth. Not like I'm talking to you, you talking to me, and you're sitting over there, and then now I'm giving you a SARS-CoV. No. Like, we'd have to be really close. Also, when you touch the dirty knob that somebody else touched, they touch the knob, and then you touch the knob, you didn't wash your hands, and you go, oh, my nose is itching, itch your nose, and then now you've had a little SARS-CoV-2, just go ahead and enter your body. And it is a virus that does bind to the cell very quickly, and they said it replicates very fast, okay? So also another thing that they're saying is that it binds to your hemoglobin, your red blood cells, where your oxygen is like located, right? All which would make sense. And of course it starts traveling and everything, and it's replicating fast. While it's doing that, it's attacking the oxygen in your blood cells, which is letting loose just naked iron. You could say free radical ions all around your blood vessels, which should not be there, which can go to your lungs and just all that's moving around. So, symptoms of cove: fevers or chills, cough, shortness of breath, difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. And then there's severe symptoms such as, of course, again, the trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, pale gray or blue colored skin, lips or nail beds depending on the skin tone. So if you have a darker skin tone, sometimes you can't tell if you like going pale or whatever. Your nail beds will really let you know. All right, now you might have nausea, vomiting, or diarrhea. So some few people said that they had like a stomachache type virus of it, like a stomach flu where they kept pooping, or they felt nauseous or whatever. So just in that situation, I would definitely say stay hydrated. Stay hydrated. In all the situations, stay hydrated. But in that one, stay hydrated. Of course, we already talked about talking to your doctor or whatever. So that's kind of because you have to let it run its course. You don't want to so when you have diarrhea, you really shouldn't be like, oh, I'm going to go ahead and take Imodium, because you kind of want whatever's going on in there to just kind of get out. Okay. So, and if you are vomiting, you're not going to be hungry wanting to eat because you're just going to keep throwing up, right? Make sure you take your sips of clears, whether it be water, ginger ale, maybe munch on some crackers. You want like crackers or toast, rice, all those kind of things too. They kind of bind the diarrhea up too. And they also like nibbling on the crackers when you're nauseous. It's good. You're eating something, but you're not eating something too heavy. Also, popsicles. Popsicles are amazing when you're going through those kind of situations, okay? The shortness of breath, difficulty breathing, anything to do with not being able to breathe. You're having chest pain, you call 911. You don't even waste time with like, oh, let me see, maybe if I no, you call 911. With the difficulty breathing, you just basically probably going to get like some ineffective airway clearance. Now, the thing is, the little chest that the pain that you might feel in the chest, they're saying that your lungs, they have like this glass look on the x-ray, like an opacity or whatever. And so they're still trying to we're trying to figure out what it is. But a lot of doctors are saying that, I've heard doctors say that it is actually when the iron is so free in the blood vessels like that, it can tighten your lungs. Also, there's people who, when they were saying, I can't eat, smell, or taste anything, I've heard a lot of people say to me, everything I taste or everything I just have a metal taste in my mouth. It might be from the iron that's like free, the free iron that's just now like being like iron radicals in your blood cells. So that's why things can taste like metal. You probably, with that chest tightening, you're going to start building secretions down at those lower lobes of the lungs, and you don't want that there. Okay? So what you need to do is learn the proper way of coughing. All right? So the proper way is you take a deep breath, you hold for 2 seconds, and cough 2 or 3 times in succession. So you would like, you know what I mean? Like, and it will start breaking up. Here's the rationale. The most convenient way to remove most secretions is coughing. So it is necessary to assist the patient during this activity. Deep breathing, on the other hand, promotes oxygenation before controlled coughing. So you get the oxygen into your lungs while opening up your lungs, and then you do a controlled cough to get the crap out. And that's what I call it. Cough the crap out, right? And there's like positioning, like you might want, if you need to have like a good forceful cough, sometimes it's good to hold a pillow to your stomach and, you get a good cough going, because you use your powerhouse for everything. There's this apparatus called an incentive spirometer, and I swear by it. When I was working with this one nurse who was very meticulous about a lot of things. A lot of people didn't like her. Okay. So anyway, she had a geriatric patient who had a temp of like 100.1. So she didn't want to rush and give Tylenol, because technically our protocol was like 100.4 for the Tylenol. So she gave the lady the incentive spirometer, and she made sure she used it every 15 minutes for like, I think it was like a couple hours or maybe 3. By the time she came back over, the lady's temperature went down to like 99.0. And that is a significant difference. And why does that happen? Is because the lady coughed up. That incentive spirometer made her open up her lungs, and she ended up coughing up a lot of that junk. A lot of times when you cough up a lot of that junk, your body knows to bring the temperature down because you're getting all that foreign stuff out of there. Then it doesn't need to be like killing everything, you know? And sometimes like some chest percussions, like if you have somebody in the house who could like hit your back or whatever, that could break up secretions too. Also, you definitely want to stay hydrated. All right. A lot of times when you staying hydrated, it's going to make you pee. And you'd be surprised, like you're peeing out like a lot of the crap that's inside of you. So that's a good idea too. I mean, obviously, if you have some other contraindicated reason why you can't just be drinking water for just a bunch of water, then obviously you don't want to just do that. You don't want to just lay around. You might feel the exhaustion, the malaise. You don't want to just lay around because if you lay in the same spot, that's how secretions build up and you get yourself in a worse position. You do want to move around as much as you can, because it'll break up the secretions and then you could cough the crap out. Also, too, a little bit of like, NSAIDs being Motrin, ibuprofen. Again, I'm not writing scripts for anybody. I'm not prescribing anything. But it helps with the inflammation because now that the virus has entered your body, there's going to be some inflammation, especially with the healing. It'll help with the inflammation. It'll also help with the fever if you have a fever, okay? I like a little bit of a fever. Sometimes it like kill viruses, but the Motrin will help with the inflammation. Also, we should talk about things like boosting immune systems. You know, maybe talk to your doctor, ask them if you need like a vitamin D regimen. A lot of people are lacking vitamin D in the nation, and I think we're just now really finding it out. Taking vitamin C is good. You know, immune boosting is very, it is important. It works. It's real. Your body was designed to do a lot of things. And a lot of times we abuse our bodies so they don't work to their full potential. So we can boost the immune system and see where they go with that. They're doing amazing things with immune boosting, even with like cancer. So you'd be surprised what your body is supposed to do. Even me, I'm like telling you this, and it's amazing what the body can do. And I'm still abusing my body. Need to stop. Okay. Message. Okay. So those are just like a few things. And they may not sound like a lot, but I knew people who didn't know a single thing to do until things got too bad, you know? And so post-jab cove, because you might get that. You might. That I heard is a little bit more aggressive. Stay on top of the breathing. Cough the crap out. I can't stress that enough. Cough the crap out, because that's what keeps, when the secretions stay in, that's what keeps pneumonia will build up fast, especially with this. If you get post-jab cove and it's bad, the secretions will build up fast. You need to cough the stuff out. You definitely need to get in touch with a medical professional because it can get aggressive and it can move very quickly. But even that much, like I said, if I can keep with you, cough the crap out. Deep breath. Open the lungs. That's the most important thing. You're breathing. It's like the ABCs of nursing, they call it. So A is airway, B is breathing, and C is like circulation, right? So your airway, your breathing, that comes first before even your blood circulation. Cough the crap out. Just a few tips in this video if they can help anybody, because like I said, we didn't even discuss what happens now if I get it. It is not a death sentence. It is, for some people aren't even going to feel that they got it. Some people aren't even going to feel anything, or they just might just be a little congested. Just might feel just like the cold, like a lot of times it is. But just so we could start from somewhere and have just like a baseline understanding. And that's what this video was about. So if you guys like this video, go ahead and hit the like button. Comment below, tell me if you've learned anything that helped you. Sometimes if I don't reply back to comments or whatever, YouTube has this weird thing it does where it doesn't let me see all the comments. I don't know why. It is frustrating. But I appreciate everybody who does drop a comment. I really do. I appreciate you watching. I appreciate the subscriptions. If you haven't subscribed yet, you know, you can just put one right there. Maybe not. I don't know. So, all right, you guys have a good rest of your day, and I'll see you at the next video. Bye.